I have low testosterone. There, I said it. How did I know? Well, I didn't really. See, I figured low testosterone.
Well, those low T ads are everywhere these days. Testosterone therapy is being touted almost as a miracle cure for men with low energy and sex drive. For some, it is. The number of prescriptions have tripled since 2001. However, there are concerns about low T treatments. One study ties the therapy to heart attacks and strokes, and lawyers are starting class action lawsuits. We take a closer look tonight in tonight's cover story.
Medical alert. Serious injuries may be linked to testosterone therapy, including the use of gels and injections.
Some lawyers are preparing for what they think will be a wave of low T lawsuits from men who may have suffered a heart attack or stroke linked to low T therapy. San Antonio lawyer Dennis Peary says he's working with clients now.
I'll be happy to review cases from anyone who has had an adverse event and they want someone to look at the case and see whether or not there is a case.
One study says there is a twofold increase in the risk of heart attack shortly after beginning the therapy in men under 65 who have a history of heart disease. Increased stroke risk is also a concern. But a new University of Texas at Galveston study recently revealed no heart attack risk. One doctor says it's way too early to tell if low T treatments are safe or not.
We don't know very much about this therapy. What's going on is a giant experiment with American men's health at stake because we don't have the long-term data on the safety of these products.
How have you been feeling?
Very good.
54-year-old Kyle Walker knows the risks, but says low T therapy changed his life.
For me, it's an easy decision. With the improved lifestyle that I get from the Testapel, it's a hands-down decision for me.
And you'll just feel some pressure.
Before treatments, Kyle says something was off.
Fatigue, lack of energy, kind of a, not necessarily cloudy, but focus is not as good as it used to be. Libido not as good. Just a number of things that, and truly I didn't realize they were a problem.
Have you noticed the impact on that treatment?
Dr. Parviz Kavusi is Kyle's physician. He's been treating men with low testosterone for more than a decade. He's not convinced by the studies.
After having read all these studies closely, they are very flawed studies. None of them is perfectly done. None of them are done with the level of confidence that I would say really make me worry at this point.
Dr. Kavusi says he monitors his patients and tracks their testosterone levels with a series of blood tests to make sure the treatment is necessary. He says he is concerned about men getting low T therapy when they really don't need it.
There is the potential for abuse with testosterone. It's a controlled drug, and abuse of testosterone looks like it looks when guys are using it anabolically like steroids. They're going well above a normal level in a super therapeutic range, and that can be dangerous.
Now, the Food and Drug Administration is investigating.
For me, the jury is still out, and until I see some concrete evidence that this is a problem, I'm not worried about it.
Now, the FDA issued a safety alert while it continues its investigation, but it's not asking doctors to stop treatments, and it's urging patients to talk with their physicians about any concerns they may have.